Hello, good afternoon, everyone. See, there's a few folks piling in, so we'll give them a second before we get started. I'm seeing our numbers slow down, so I think we can go ahead and get started. Hi, everyone, and good afternoon. Thank you for joining this webinar on the California Opioid Settlements Annual Expenditures Report for State Fiscal Year 22-23. My name is Audrey Richardson Salinas, and I work for a Rare Health Group. We're helping the Department of Healthcare Services facilitate today's call. Next slide, please. Okay, some housekeeping items here. During this call, if you have any technical difficulties, please send a direct message to Christina Chu from the Aurora team, and she'll help you resolve any of those issues. Today's webinar is going to include some time for questions, and if you have any questions related to content outside of the report or what's covered today, we do recommend that you contact DHCS via email, and we'll drop that email in the chat during the Q&A session, so no worries about jotting that down just yet. Any questions that we don't cover today will be compiled in a Q&A document and posted to the DHCS Opioid Settlements website. Today's materials will also be posted to the webpage and should be up to the webpage available later this week. Next slide, please. For today's presenters, we will be joined by several staff members from the Community Services Division from DHCS, which is tasked with monitoring expenditures and reporting requirements for the funds received from the opioid settlements and bankruptcies. Staff presenting today include Marlise Perez, Sandy Snellgrove, and Jenny Davis. Before I turn things over to them, there are a few additional details I want to discuss. Next slide, please. First, here is our agenda. During the webinar, DHCS will provide an overview regarding the purpose of the annual report and the meeting that we're having today. The team will then provide some background on California's opioid settlement and bankruptcy agreements, as well as expenditure requirements for the 3 agreements that distributed funds to California during the fiscal year 22-23. DHCS will then provide an overview of key findings from the annual report, including a summary of payments received and expenditures for cities and counties. We'll end today's session with that Q&A for participants. Next slide, please. A quick disclaimer here. So we understand that many of you joining us today may be new to this work or new to the opioid settlement agreements broadly. And so this presentation will include some summaries of the national and state-based legal agreements with opioid manufacturers, distributors, and other entities. In the event that there are any discrepancies between what is said today and the more nuanced language within those legal agreements, please know that those legal agreements do supersede any information provided. Our presenters will simply be distilling some of those important points from those very lengthy agreements to provide some background for those joining the call today. Next slide, please. Well, enough from me. I will now turn things over to Marlise Perez, Division Chief of the Community Services Division from DHCS. Marlise will walk us through the purpose of the annual report and provide an overview of the opioid settlements and bankruptcies. Marlise, please take it away.
Great. Thank you so much, Audrey. And first of all, I just want to thank everybody who is joining us today or watching this recording. And I just want to, first and foremost, as we proceed with this work, I just really want to acknowledge that this is, there might be folks listening that have lost a loved one or had a loved one that has suffered with an opioid use disorder. And I want to acknowledge that throughout this whole process at DHCS, we're keeping you at the forefront because we really want to ensure that we are effectuating our role at DHCS in overseeing these funds, not only the funds that are provided to our county and city partners, but also the funds that are at the state level. And so that really is the role of DHCS. We have been partnering really closely with the Attorney General's office, and I'll be talking in a little bit here about new settlements and when settlements or bankruptcies come down, and they've been incredible partners. But our role at DHCS is to really ensure that these funds are used for opioid remediation. And we'll talk a lot about that, but also is preparing this annual report, which we're really excuse me, we're really excited to be able to provide to you today. And really what today is, we do have an obligation to meet with you folks and discuss this report, but it's more to us than that. We really want to hear your feedback as we present this information. So please take advantage of this time at the end with the Q&As. But as Audrey said, along the way, feel free to pop your questions in the chat. So we have those all teed up when we get to that portion of the presentation. And so this annual report, so this is a requirement for any of our participating subdivisions. You're going to hear that term a lot today, but those are our cities and county partners that are receiving funds from any of the settlement agreements or the bankruptcies. And you'll also be hearing, like, as we get new ones in, we're going to be using the same report format, so it's all together in one place. But what we're talking about today is specifically covering the fiscal year of 22-23. That's our state fiscal year, and that runs from July into June of the next year. And so these reports were submitted to DHCS, which is a requirement to receive these funds between August and October of 2023. And so, as I already mentioned, part of our oversight and monitoring requirements is collecting this report and ensuring that these funds were used for opioid remediation. So these reports will be made available. They must be made available on our DHCS website. So you will have access to those, not only for this reporting period, for any subsequent reporting periods as well. And of course, as I mentioned, then we host this meeting, so you'll be able to see us annually, if not more often, just talking about the report and the findings from the report. Next slide. So we wanted just to spend a brief amount of time with you here and just kind of walk through a little bit around the national opioid settlements, but also those bankruptcy agreements as well. Next slide. So really what kicked us off with the opioid settlements was around the Janssen, I like to call it the J&J. This was really the first key settlement that we received here nationally, but then here in California that was negotiated. And these settlements are I just want to make sure it's clear. The money flows right to the counties and the cities that participate in these settlements and bankruptcies. None of the funding comes through DHCS. But once that funding received, like I said, then that oversight responsibility is where DHCS kind of kicks into that. And so these were the first settlements that came forward. And then the payments, though, are distributed by Brown Greer. And those, once again, go directly to our county and city partners. Next slide. And so then what followed in 2020 was a bankruptcy, and this was with Mallinckrodt. And so with this bankruptcy, there was a $1.7 billion payment, and I apologize on that last one was about $2.2 billion. But with Mallinckrodt, they did make their first payment. And that was about $450 million. But then they didn't make their subsequent payments. They then went into another bankruptcy in August of 23. And then there has been a new agreement that has been established to pay out the funding into scheduled payments. So just want to recognize for those folks that are listening today that maybe you're not a county or a city partner receiving the funds, but there is some, changes that can occur with how these settlements and bankruptcies. It's one thing about getting them negotiated, but then of course there could be changes such as these that occur through the payment process. Next slide. So there are additional settlements and bankruptcies that are on the horizon. And so we just really wanted to walk through here. These are a list of some of the final agreements that have landed, but you'll also see there are a few more that are pending. And so what really happens in this case, once again, we work with our partners at the Attorney General's office when there's either a new settlement or bankruptcy agreement, and they help us coordinate that information. And then, of course, that is then relayed to us and to our partners. And then once again, that is part of the reporting and then the monitoring that DHCS does. So for all of these new, whether they're final or still in the proposed, depending on when they're actually final, will depend on when the payments will be reported to DHCS. But we're really clear about that and which of these are on deck for which reporting periods. And then I also want to clarify too that some of these settlement agreements can be, 18, 20 years. That the funding comes out. So then our partners are also reporting that to us per the different settlement and bankruptcy agreements for that period of time that funding is allowed to be expended. But there is a lot more information on the Attorney General's website that we have linked here. So if you're interested in any of these, of either the final or the pending, you can always get up-to-date information here at this link. Next slide. So with the settlement agreements, as I mentioned earlier, and this is something that is under the purview of DHCS, we really need to ensure that this funding is used only for opioid remediation activities. If it's found that they are not, we do have authority to take action. So we are very, cognizant of this tremendous responsibility to really ensure that these funds are appropriately used. And so for that guidance of what we follow, first of all, it's really defined as care, treatment, and other program and expenditures. And you'll see here whether it is to address misuse and abuse of opioid products, treating or mitigating opioid use or related disorders, or mitigating other alleged effects, including of those injured as a result of the opioid crisis. And so through this, you can move to the next slide. There is very detailed guidance, and that is what's known as Exhibit E of the national agreements, and those came out with the first J&J agreements. And so there's a very extensive list in Exhibit E that if you have not reviewed this, would encourage you to look at this guidance. And you'll see here it's broken down into these core strategies, which are known as Schedule A, and then Schedule B, approved uses. So really what that means are these Schedule A around these core strategies. This was identified at the national level when these first settlements were being negotiated. And then Schedule B is really more of a list that has these activities that could be meeting that function. And then also DHCS has provided some further guidance in some of these spaces as well, if there's any questions around that. And we also work with our partners as they are completing our reports to ensure that they are, adhering to these various rules. Next slide. So these are I touched on these a tiny bit earlier, but these are some of the approved uses. And you'll see here, these really run the gamut across the prevention, harm reduction, treatment, and recovery services kind of lens over substance use disorders in general, but obviously pertaining to an opioid use disorder. But you'll see here, these are some of those categories that I mentioned, and also once again that we have provided lots of detailed information on to help our partners ensure that they're using the funds appropriately. Next slide. All right, so let's see here. I think, is this you, Sandy?
This is me. Can you
This
hear
is
me?
you. So wait, before Sandy starts, I do just want to introduce Sandy Snellgrove. So she is really one of the leads that I have the privilege of working with at DHCS, as well as Jennifer Davis, who's going to speak later. And I just want to thank her publicly, and Jenny as well, for all their efforts. You could not find two more dedicated people that care passionately about the people we serve and ensuring that all of these settlements and bankruptcy agreements are effectuated properly. So with that, it's a privilege to turn this over to Sandy, and she's going to walk you through the background and various other topics for the remainder of this presentation. So Sandy, take it away.
Yes, thank you, Marlise. Good afternoon, everyone. You're going to be spending a little bit of time with me as we go through the next bulk of slides. So I'll do my best here to make this as little painful as possible, because these settlement agreements can be a bit complicated. So as the national settlements were finalized, the state of California, along with its cities and counties council that represented them, reached agreements to further define how the funds would be allocated at the local level, and also the uses of payments from the national opioid settlements. These agreements are referred to as the state subdivision agreements, and they are formally adopted by California and its cities and counties through an official sign-on process. These state subdivision agreements also govern the payments and expenditures, and also are the agreements that gave DHCS the authority to collect reports, as well as draft this annual report and conduct this annual meeting. Next slide, please. The state subdivision agreement determined allocations of all the funds that will come to California. 15% of the funds will go to California, the state directly, and those funds must be used for future opioid remediation. In addition, the California Abatement Accounts Fund is 70% of the funds that will flow to California, and that will be allocated to all participating subdivisions. Again, as a reminder, participating subdivisions are those cities and counties that are participating in California in all of the settlements. Those funds must be used for future opioid remediation, and it's important to note that the state subdivision agreements, unlike the national agreements, restricted the use of these funds specifically for activities that are listed in Exhibit E of the national settlement agreements. In addition to that, California went on to further define that no less than 50% of the funds that are received by participating subdivisions from the Abatement Accounts Fund will be used for one or more high-impact abatement activities. Later on in the slides, I'll get in a little bit more detail about what those high-impact abatement activities are. But it is 50% of the funds received in each calendar year by any city or county must be used for one or more of those high-impact abatement activities. Additionally, 15% of the funds will go to California Subdivision Fund. That's allocated to cities and counties that were initial plaintiff subdivisions. Those funds must be used to fund future opioid remediation and can be used to reimburse past opioid-related expenses, which may include litigation fees and expenses. Next slide, please. Background I'm going to provide on the statewide abatement agreement. Next slide, please. Just a reminder that this report is for fiscal year 22-23, so this would be any expenditures and any payments that were received by California and its participating subdivisions from July 1st through June 30th, 2023. So we go on a state fiscal year. And so this report, the entire report will reflect that 2022-23 fiscal year. During that year, we received payments from Janssen, known as Johnson & Johnson, as well as the 3 distributors that Marlise mentioned in previous slides, as well as the Mallinckrodt bankruptcy. For the Mallinckrodt bankruptcy, there's the California statewide abatement agreement. And again, like the settlements, the state of California and its participating cities and counties established the local allocations, the allowable uses, and payment allocations in the statewide abatement agreement. Again, this was formally accepted and adopted by California cities. There are some determinations on which cities would receive funds from either this Mallinckrodt bankruptcy as well as the settlements. Although a city may opt in to participate in the settlement or the bankruptcy, they can also opt out of receiving payments. Those payments would then be directly routed to the county in which the city is located. So I just kind of wanted to give you that caveat. When you're looking at the report, you may see eligible and participating cities, but what you might not see is that they received a payment, and that would be the reason why, is that they opted out of receiving that direct payment. Next slide, please. Again, the statewide abatement agreement also determined how the funds that flow to California would be allocated, and 40%, the state share, would be allocated to the state of California to be used for state-directed opioid remediation activities. And then 60% would be allocated to local governments or participating cities and counties And again, the state's abatement agreements also restricted the way that those funds would be used. And in the Mallinckrodt bankruptcy, it's called Exhibit 4, but it is exactly the same Exhibit E of the national opioid settlements. So the uses for these funds from the Mallinckrodt bankruptcy must be used for activities that are actually listed in Exhibit E. Next slide, please. We're going to talk a little bit about the opioid settlements and annual expenditures report process. We felt that it was important for all of you to understand really like what process we go through as we collect these reports from California cities and counties. And so we'll talk a little bit about that in the next few slides. Next slide, please. Again, going back to the state fiscal year, is that payments and expenditures are reported on through a state fiscal year. So any payments received or expenditures from July 1st through June 30th of each fiscal year would be reported. And those reports are done via an online reporting form that DHCS has developed. And the reporting is due by September 30th of each year. After a participating subdivision submits its report, sometimes there are reports that would require no corrections. And if that's the case, DHCS, the opioid settlement oversight team here at DHCS, would then send emails to the participating city or county, letting them know that their report has been considered complete and accepted by DHCS. However, if their submitted report requires some clarification or corrections, DHCS will contact that participating subdivision to request more detail, request potential corrections and amendments to the reports. Please note that DHCS is also providing technical assistance throughout this entire process as well. Next slide, please. Any participating subdivision that is instructed to amend their report would do that jointly with DHCS through technical assistance and a series of conversations to make sure that the expenditures are actually properly documented. And just as a note, it's important that if there are any uses that are inconsistent with the eligible uses, DHCS would then escalate that information to our department's Office of Legal Services, as well as coordinate with the California Attorney General's office. Next slide. How we approach the data analysis. Once all of the participating subdivision reports have been submitted and accepted by DHCS, we'll start the analysis and start aggregating that data so that we can prepare this annual report for the entire state. The data is collected and analyzed by UCLA Integrated Substance Abuse Program, prepared by DHCS with the assistance from our partners on the meeting today, Aurora Health Group. Of course, the data analysis includes summarizing those payments and expenditures, not only by the allocation types, again, the abatement account, subdivision fund, and the state amounts, but also the expenditures by each individual settlement. And then, of course, we would then use that information to summarize expenditures by those eligible uses in Exhibit E, those categories, any non-Exhibit E activities, administrative expenses, and of course, the high impact abatement activities and any past legal expenses. Next slide, please. Let's just jump into the next slide. We're going to talk about the bankruptcy payments and settlement payments. For fiscal year 22-23, the state of California as a whole, this is California and its participating subdivisions, received over $362.5 million from the opioid settlements and the Mallinckrodt bankruptcy. Of that amount, over $221.5 million was paid directly to participating subdivisions, and over $141 million was paid directly to the state of California. Next slide. This is a list of those payments from settlements and the bankruptcy. As you can see, Janssen settlements made payments in 22-23, as well as the 3 distributors made payments. The Mallinckrodt bankruptcy payments are included here. And there was a McKinsey settlement which was for states only. And so the state of California received a settlement from McKinsey. But because those funds are still restricted to opioid remediation activities, we included this information in our report because we will talk about the state's use of all of the payments that we received. Next slide, please. We're going to go into a little bit detail about California state-directed projects. As a reminder, from the settlements, there's 15% that's allocated to the state of California for state-directed opioid remediation activities. Next slide. And from the Mallinckrodt bankruptcy, there's also the 40% state share, also allocated to the state for state-directed opioid remediation activities. Next slide. It's important to note, because as you look at the report, you may see that this total amount that was received by the state of California may not necessarily be the full amount that was appropriated for state-directed activities. So payments that are received by the state first go to the Litigation Deposits Fund, and that's administered by the California Department of Justice. The Department of Justice may hold back funds from each payment for the state's cost for opioid-related investigations and litigation, respectively. The remaining funds are then transferred to the opioid settlement funds, the Opioid Settlements Fund, which is administered by Department of Healthcare Services, but those funds are appropriated by the California state legislature through our regular budgetary process. And those activities are also typically going to be, or have been to date, allocated to state departments within California for to pull out to do state-directed opioid remediation activities. Next slide, please. Of the over 141 million that the state received, you can see here that roughly 78 million was appropriated to Department of Healthcare Services, 4 million was appropriated to Department of Rehabilitation, and roughly 45.8 was appropriated to the California Department of Public Health. Next slide. This is a list of the state-directed projects for fiscal year 22-23. Department of Healthcare received Healthcare Services. Our department received 51.113 million for grants to treatment organizations to provide SUD treatment provider internships and training opportunities, in essence, to increase the substance use provider workforce. In addition, CDPH received funds for a statewide opioid overdose prevention and education media campaign. DHCS naloxone distribution project received 15 million specifically to distribute naloxone to organizations that specifically work with homeless individuals. Also, the DHCS received 7.5 and 1.7 million for a treatment locator, as well as an anti-stigma campaign. And then again, 5 million went to CDPH, and this is for the California Opioid Overdose Tracking System, which tracks opioid-related overdoses across the state. And then the 4 million that went to Department of Rehabilitation was a pilot program working with SUD providers on incorporating employment, training, and support into treatment. In addition to that, 2.716 million was allocated to the Department of Healthcare Services, which includes the staff that are responsible to administer and oversee California's opioid settlement funds. Next slide. All of the state-directed projects were classified and placed in Exhibit E categories. As you can see, there's a large portion went for the treatment of opioid use disorders, opioid misuse prevention, harm reduction, some leadership planning and coordination, and then connections to care. Next slide, please. California Abatement Accounts Fund expenditures. This is specifically that 70% from the California Abatement Accounts Fund. This goes directly to participating subdivisions. I think it's important to note that the settlement fund payments do not pass through DHCS. Those payments are made directly by the directing administrator, which is Brown Greer. So none of the payments that are going to local governments and city and counties are passing through Department of Health Care Services. Those funds must be used for future opioid remediation, and the state subdivision agreements restricted that to activities specifically listed in Exhibit E. In addition to that, and I promise I'm going to get to this in a slide or two from here, is that no less than 50% of the abatement accounts funds that are received by cities and counties must be used for one or more high impact abatement activities. Next slide, please. There are some additional rules for the abatement account funds. The national opioid settlements allowed for reasonable and related administrative expenses. DHCS has established some policy, which we do in behavioral health information notices, and has identified those administrative activities as indirect costs. And for the abatement account funds, those total indirect costs may not exceed 10% of the total allocation. We are providing the slides. They, again, like we mentioned, they'll be posted on the DHCS opioid settlements webpage, and links are provided in the slides, as well as these policy documents are available already on the DHCS website. So in addition to that, many participating cities and counties will place their opioid settlement funds in interest-bearing accounts. DHCS has also established policy that would require any interest earned on those funds also be appropriated back into eligible uses per Exhibit E activities. It's also important to note that once those payments are received, specifically, those funds must be expended or encumbered within 5 years of receipt, or 7 years if they're for a capital outlay project. Next slide, please. All right, on to California's high impact abatement activities. In addition to activities listed in Exhibit E for the abatement accounts funds, California and the council that represented California cities and counties also agreed on a set of 6 additional opioid remediation uses. And again, these funds, it's 50% received within a calendar year, must be expended on one or more of these high impact abatement activities. And as you'll see in the next slide, we list these high impact abatement activities. Some of them are actual activities, and some of them are really just to direct funds to services for populations that have been disproportionately impacted by the opioid crisis. Next slide, please. These are California's high impact abatement activities. You can find them again once we post these slides, but they are available in the state subdivision agreements as well as on the DHCS opioid settlements webpage. But in essence, number one is DHCS has the Behavioral Health Continuum Infrastructure Program. This is funding that's been allocated to local governments as well as organizations to expand the substance use disorder and behavioral health infrastructure across the state of California. So if a city or county that receives abatement account funds has an approved project through BCHIP, you could use the funds for matching funds or operating costs for that facility. Activity number 2 is, of course, creating new or expanded substance use disorder treatment infrastructure. Number 3, addressing needs of communities of color and vulnerable populations, primarily those that are disproportionately impacted by substance use disorders. Diversion of people from the substance use with substance use disorders from criminal justice systems. Again, we really want to see treatment being provided in lieu of incarceration. Number 5 are interventions to prevent drug addiction in vulnerable youth. And number 6, which was recently added by Department of Healthcare Services, which is the purchase of naloxone for distribution and efforts to expand access to naloxone to prevent opioid-related overdoses. Next slide, please. Of the California Abatement Accounts Fund, what we saw is that of the 221.5 million, that the expenditures by California's participating cities and counties was low at roughly 4.3 million. And then a very, of course, small portion of those funds were spent on administrative costs. You'll see further when you're reviewing the report that a lot of cities and counties were reporting, it was kind of the first year. So a lot of planning efforts were being put into place on how to effectively use these funds. So what we saw in 22-23 were the initial set of payments coming in to California, and very minimal spending, as most cities and counties were doing planning activities. Next slide. This is a breakdown of that almost 4.3 million, I think it was. But what you'll see is that the largest share of those funds, almost 49%, were spent on harm reduction activities. Again, these are those major categories that you'll find in Exhibit E. And then this is the relative spending per those categories in Exhibit E. This information is presented as such in the annual report. Next slide, please. This is also of the funds that were expended from the abatement accounts. These are the expenditures specifically that were eligible for high impact abatement activities. 92% of the funds that were expended by cities and counties met high impact abatement activity requirements. Next slide, please. This is the California Subdivision Fund expenditures. Next slide. Just to recap, this is the 15%. It's allocated to cities and counties that were initial plaintiff subdivisions. They're also participating subdivisions. These funds must be used towards future opioid remediation projects and to reimburse past opioid-related expenses, which could include litigation fees and expenses. As you can see, that's really 85% of the funds flow directly to California cities and counties. Next slide, please. The definition of an initial plaintiff subdivision. There are roughly, don't quote me on this, about 79 subdivisions that were considered initial plaintiff subdivisions. And these are subdivisions that filed a lawsuit on behalf of the people of state of California against one or more of the opioid defendants prior to October 1st. Opioid defendants, of course, being those manufacturers and distributors of opioid-related products. And throughout the report, because they are also participating subdivisions, we reference them as participating subdivisions throughout the report. Next slide, please. This is just a revisit on those allowable uses. Subdivision funds can be used as defined in the National Opioid Settlement Agreements for opioid remediation, which is defined as care, treatment, and other programs and expenditures. This is to address the misuse and abuse of opioid products, treat or mitigate opioid use or related disorders, or mitigate other alleged effects, including on those injured as a result of the opioid crisis. The California state subdivision agreements do not restrict subdivision fund to Exhibit E uses. So those funds may be used for Exhibit E activities, of course. Opioid remediation activities not listed in Exhibit E, and to reimburse those past opioid-related expenses. Next slide. Additional expenditure rules. Again, the national settlements allow for reasonable related administrative costs, and although not a requirement to adhere to DHCS established policy on indirect costs capped at 10%, DHCS does encourage plaintiff subdivisions to follow that 10% rule so that most of those funds are really flowing towards opioid remediation activities in an effort to really abate the opioid crisis. And again, these funds can also be placed in interest-bearing accounts. Next slide, please. All right, the subdivision fund expenditures In 22-23, there were 10 cities and counties that reported spending over $546,000. Of that amount, it was pretty evenly distributed between Exhibit E activities, non-Exhibit B, Exhibit E activities, and past legal expenses. And as you can see, a very small portion was spent on administrative costs. So again, what we're seeing here is this was the first year as payments start to flow into cities and counties, lots of planning, taking the time to understand the allowable uses and the agreements, that we are still seeing pretty low spending within this fiscal year. Next slide. All right, California local share expenditures from the Mallinckrodt bankruptcy. Next slide, please. To recap, this is the 60% local government share from the Mallinckrodt bankruptcy. Something I'm not sure if we noted before is that the Mallinckrodt bankruptcy payments also flow directly to California cities and counties. The funds do not pass through DHCS. And these funds, unlike settlements being paid directly from the directing administrator, these payments are coming from the National Opioid Abatement Trust too. And so many cities and counties that may be on this call probably saw that these payments come from NOAT too, and not a lot of reference in those payment deposits mentioning the Mallinckrodt bankruptcy. So a little confusing, but Mallinckrodt and NOAT. But those funds also must be used for future opioid remediation activities as listed in Exhibit 4, which is Exhibit E of the National Opioid Settlement Agreements. These funds are a little bit more restrictive, and like the settlements, they must be an activity that's listed in Exhibit E. Next slide, please. The statewide abatement agreement also allows for approved administrative expenses. And pursuant to that agreement, 95% of the funds will be used for Exhibit E activities, and no more than 5% may be used to fund expenses incurred in administering those activities. So no more than 5% for administrative expenses when using funds from the Mallinckrodt bankruptcy. In addition, although not specifically stated or required, we would also encourage subdivisions to place these funds in interest-bearing accounts, and if so, apply all of that interest towards opioid remediation activities. Next slide, please. Again, what you're seeing is just pretty relatively low spending for the same reasons. The local government share expenditures were roughly around over 120,000 for the local governments, and of that amount, 99% were used towards Exhibit E activities, and a very low amount were used for administrative costs. Next slide, please. These are the expenditures by Exhibit E category. So as you can see, again, there's this large portion that was used for the treatment of opioid use disorder. Unlike the abatement accounts fund, where we saw a large portion of those funds being directed towards harm reduction activities. Again, this slide and this information is available to look at more in detail in the annual report. Next slide. All right, I think, let's see, this is where I turn it over to Jennifer, is this correct?
Yep, it's me.
All right, then I'm going to go ahead and turn this over to Jennifer Davis. Jennifer Davis is really leading the team that has more hands-on for oversight and monitoring of California's opioid settlements. Their work has been impeccable in partnering with our local cities and counties and ensuring that these funds are really pointed at abating the opioid crisis. And so without further ado, Jennifer Davis from DHCS, it's all yours.
Thank you, Sandy. The next few slides will cover DHCS's key findings after reviewing the submitted expenditure reports for fiscal year 22-23. Next slide, please. Over $127 million in opioid settlement funds were appropriated by California in 2022 for the fiscal year 22-23 state budget. These appropriations went to the Department of Healthcare Services, California Department of Public Health, and the Department of Rehabilitation. In total, funds were appropriated to implement a substance use disorder workforce initiative, opioid awareness and anti-stigma campaigns, naloxone distribution through the Naloxone Distribution Project, a statewide treatment facility locator, and money to support and improve statewide overdose data collection and analysis. More information on these projects can be found in the published annual report, as well as on our DHCS California Opioid Response webpage. Next slide, please. As Sandy mentioned, overall, we saw low actual spending in fiscal year 22-23, with only about 2% of received payments being spent, or roughly $5 million out of over $221 million in total received payments. Because this was everyone's first year receiving payments from these settlements, it's not completely surprising that cities and counties seem to focus more on understanding the spending requirements and carrying over their funds to spend strategically in future years. As a reminder, cities and counties do generally have 5 years to expend funds or 7 years for capital outlay projects. Cities and counties may also encumber their funds locally to support projects over multiple years. Next slide, please. In the spending that we did see from cities and counties for fiscal year 22-23, most were attributable to an Exhibit E category, with support for harm reduction initiatives and programs being the overall winner. And the reason it's most and not all is this percentage is inclusive of subdivision funds, which are able to be used for reimbursement of past opioid-related expenses, including legal costs related to the litigation. This percentage also includes administrative costs, of which we saw account for less than 1% of overall spending. We also saw that the largest high impact abatement activity was number 6, which is the purchase of naloxone for distribution and efforts to expand access to naloxone for opioid overdose reversals. Next slide, please. While compiling data from the local expenditure reports, there were a few examples of some innovative strategies we noticed deployed by cities and counties that DHCS decided to highlight in our annual report. These projects include expanded housing and substance use treatment, overdose response boxes with naloxone and instructions for administering, overdose response programs, and an overdose surveillance and response program. More information on these projects can be found in the published annual report. Next slide, please. DHCS is currently in the process of reviewing submitted expenditure reports for fiscal year 23-24. More settlements have begun issuing payments to the state and its cities and counties, which will be accounted for in future reports and meetings. Additionally, we don't expect to see any additional Mallinckrodt payments made after fiscal year 23-24. That is, of course, a payment was delayed or returned, in which case that city or county may receive their payment later than intended. Next slide, please. And with that, I'll turn it back on over to Audrey.
Thanks, Jenny, and thanks, Marley, Sandy, and Jenny for that really helpful overview. We're going to move on to the open session for questions. Next slide, please. So as we transition to our Q&A portion, we do ask that you limit questions to the topics that are discussed today. I know that there was a lot of information covered and we have a lot of folks joining today, so please know if we don't end up getting to your question, that DHCS will be creating an FAQ document that compiles all questions we're not able to answer today. And during this time, participants can either raise their hands or drop questions in that Q&A feature on Zoom. We're going to be keeping a list of participant questions in our queue, and we'll be reading those off on a first come, first served basis. Next slide, please. This slide provides some information just on how to use the raise hand feature on Zoom. For those signing in through the Zoom app, you can go through your control panel, select reactions, and then there should be a pop-up list where raise hand is an option there. If you're calling in today, you can dial *9 to either raise or lower your hand. And again, everyone is always welcome to provide any questions in that Q&A feature. To be mindful of everyone in the room, participants whose questions take a little bit longer or might be a little bit more nuanced and required longer conversations are going to be asked to submit their questions and connect to DHCS via the DHCS OSF inbox. We'll drop that email in the chat box now, but again, we'll just want to make sure to be mindful in terms of longer conversations that might need to be continued offline. Next slide, please. And also for folks, general awareness, DHCS has published a lot of information and resources on the opioid settlement and bankruptcies on the DHCS opioid settlement website. We'll drop that website link in the chat as well. During the Q&A, we're actually going to keep this slide up just so folks can easily reference and identify any of the reference pages that are discussed. Perfect. We will go ahead and move on to our Q&A portion. I know a lot of questions have been coming in through the chat. Broadly speaking, I know one question that seems to be coming up a lot is if the slide materials and the presentation from today will be available and sent out to participants. The answer is yes, we will be posting all the presentation materials to the DHCS OSF webpage by the end of this week. Perfect. And then let's see, another question that we have here for the DHCS team is regarding how does oversight work in general in California? Folks are asking, there's some states that have oversight committees. How does that work in California? Is that similar? How does that structure just end up functioning within California? I'm curious, Sandy, Marlise, Jenny, any thoughts there?
Yeah, I can start with that. So in California, there's a few things that occurred as Sandy and I kind of walk through from the national settlements down to what California has negotiated. There are requirements that are laid out specifically in some of the agreements around that function. And so in California, it was deemed for DHCS to take on that monitoring and oversight role. And so there's a few kind of different legs to that. And so one of them is, first of all, as I mentioned earlier, DHCS does have that authority over the opioid settlement funds. There is a larger fund that was created at the state level, which is our partners at the Department of Finance oversee that fund. And then, of course, as we mentioned, the other funding really goes directly to our county and city partners. But we have the oversight at DHCS to ensure that those funds are expended properly. And so part of that is, creating the policy around that and some of the guidance that DHCS has already released. We've also done a lot of technical assistance around helping our partners understand in more detail around those Exhibit E requirements. Also, of course, creating the reporting structure and that transparency for the general public to see how those funds are being expended. And then there's another piece to this around the actual monitoring of those expenditures. And so DHCS, of course, is reviewing all of the reports in detail, ensuring that there's alignment with those expenditures, if not, providing that technical assistance to those that are submitting those reports. And if needed, there are actions and steps that DHCS can take if some of the funding is not spent according to the required guidance. And so there's really just different levels of monitoring, and this will be in effect through the utilization of all of the settlements and bankruptcy agreements. So DHCS will have that role for California.
Thanks, Marlise, really helpful. Along that same line, there are a few questions regarding how cities and counties actually decide to use the funds that they're receiving from these opioid settlement and bankruptcies. Some questions regarding just general, how do they develop kind of an expenditure plan, and what does DHCS do in terms of support or oversight during that process?
I'll start with that and probably kick it on over to Sandy to fill in. But we have, like I said, been really assisting our county and city partners with really understanding just all the way, really just even understanding what an opioid use disorder is, providing training and technical assistance, because maybe some of our partners aren't used to receiving funds in this space for substance use disorder. So we've been providing a lot of training, technical assistance around that. Like I mentioned, we have done quite a few webinars, just really detailing out the allowable uses of these funds. We've also made available just our assistance if they've wanted to, put their plan together and run it by us. We've been, very happy to assist in that space even before the expenditures were spent to ensure that they're in alignment. And anytime something comes up that we're hearing, like that somebody wants to use the funds for, which we know are not allowable, we put out that guidance as well. Because, you know, our intent is to really ensure that every single dollar is utilized for the stated purpose, just because it is such an important role that we have at DHCS, but really more importantly that we want to really prevent any future opioid misuse and abuse. And so those are some of the initial things that we've done, but I also want to just open it up to Sandy if there's anything she wanted to add.
Yeah, thank you, Marlise. I did want to add too, is that each of the states determined how the funds would be allocated within their state. So it's important to note that the way California is structured may not necessarily be how other states have structured their settlement allocations as well. So the state of California, along with council representing those cities and counties, made the decision to have those payments go directly to the cities and counties and not pass through DHCS. And again, then restricted those uses specifically to Exhibit E activities. And so also going back to this question in general, is that it's important to note that DHCS is really taken on this technical assistance role. We've created a technical assistance process. We want to be supporting our cities and counties with allowable, of course, but also really effective uses for their opioid settlement funds. And so we have on our DHCS opioid settlement funds webpage, we have a process for which a city or county can submit a technical assistance report or request. We've also published on our website some resources. We've hosted some webinars on those uses. This annual report also includes some promising practices that at the end of the report we highlighted where some cities and counties are doing some really good work with the funds that they've received. And we've also, in some of our webinars, partnered with an opioid coalition group, and we've really advocated to see cities and counties partner with their local opioid coalitions who are sort of on the grounds doing this work and really probably already have a snapshot of the gaps and what's really needed to abate the opioid crisis within your local communities.
Thank you both. I see that we have a raised hand as well from Daniel S. Daniel, I'm going to allow you to unmute. Let us know if you have any trouble there.
Sorry. So I was under the impression that all the settlement funds, whether from distributors or from the bankruptcy, had the same spending guidelines. I noticed you highlighted that for the Mallinckrodt bankruptcy. I mean, this is kind of petty. I don't foresee us using a lot of admin, but it says there's 5% admin allowable on the Mallinckrodt bankruptcy. Are there any other spending changes between the bankruptcy and the distributor settlements?
Yeah, I can take this one. The settlement agreements are structured a little bit differently than the bankruptcies or the Mallinckrodt bankruptcy, I should say. Whereas the settlement funds, the allocation structure is 85% of the funds go to cities and counties, and the other 15% come to the state. And then there are those funds that are going out to the 85%. There's 15% of the subdivision funds that have less restrictions than the larger 70% of the abatement account funds, where the restrictions really are to an activity that's actually listed in Exhibit E. The Mallinckrodt bankruptcy is very similar to that. The Mallinckrodt bankruptcy restricts uses to Exhibit E, but then further goes on to put restrictions on the amount of reasonable and related administrative cost at 95%, specifically for a remediation activity, and then the 5% for those administrative or indirect costs.
Okay. Perfect. Thank you.
Thank you, Daniel. Along that same line, questions for the DHCS team is regarding what does it mean by reasonably related administrative costs? What do these settlement agreements mean by that, and what all is included in that cap of reasonably related administrative cost?
I can take this one as well. First of all, that the administrative expenses would be considered reasonable administrative expenses. So nothing in excess. These funds really aren't set out to fill general budget gaps. I mean, we're in the midst of an opioid crisis right now. And so really what the national settlement agreements intended was for these funds to go directly towards activities to remediate the opioid crisis. Related means is that the administrative expenses or indirect cost as defined by DHCS would be related to an activity that you're administering. So we have on the DHCS webpage as well. There's a link to the behavioral health information notice, which is a policy notice. And we have a glossary on how we define certain terms. And then we also have a reasonable administrative cost policy. And we did our best to sort of attempt to spell out like what we would consider to be reasonable, as well as what would consider to be related, as well as what's direct and what's an indirect cost. So if you have a team of individuals who are running a substance abuse treatment program, and you're going to fund them to expand their facility to serve another 50 staff, which would include, maybe some modification to their building as well as personnel costs or costs related to that. Those would be considered direct expenses. Indirect costs are typically then are those activities that are not really related to a direct objective.
Thanks, Sandy. I'm seeing a few questions come in the chat as well regarding checks and balances in general. There's a lot of funds flowing to states and cities and counties. So how at a national and state level are folks able to ensure that funds are being spent in the correct way? I'm curious, anyone from the DHCS team who would like to pick that question up.
I'll start with that. Part of that, because that's been very important to us as well. Just speaking for Sandy and myself, I mean, we've been in this field over 25 years and just really seeing the devastation that the opioid epidemic has caused, not only nationwide, but more importantly here in California. It's personally important to us. And so what we really wanted to do was to start our counties and cities off with success in ensuring that this money was utilized properly. But to Sandy's point is too, but also effectively, we have in California made a lot of great strides forward in the space of substance use disorders. And so we really wanted to and have continued to highlight just other efforts that are underway in California and ways that, especially for maybe our smaller cities or counties that maybe are receiving a smaller amount of funds, where can they use that funding to make the most impact in their area, or maybe they want to use them quickly. What can they do, what space, and offering those suggestions. We have also offered just connections to some of these other efforts in California, just as one example, allowing these funds to be a match for our behavioral health continuum infrastructure program, which is building out in California actual facilities, bricks and mortar facilities, but there's a required match. So allowing the funds to be used for efforts like that as well. But like Sandy spoke about, really ensuring that we start off properly and effectively and help. I think prevention is always the best form, when you're looking instead of, having to rely on monitoring and enforcement later. And we've really seen a lot of our cities and counties be very responsive to those efforts. But then once again, when we have seen funding that may be proposed to be utilized in a way that is not allowable, is ensuring that we make that known quickly to our partners. And then once again, coming back around with that arm of monitoring, which will once again continue throughout this oversight process. So it really has been and will continue to be a priority for us here at DHCS to make sure that these funds are used properly. But like I said, also along with the other efforts the administration has been bringing forward over the last years in this space.
Thank you, Marlies. There's another kind of theme of questions coming in here regarding how does the state decide what projects it's going to fund on a state level and what state agencies are going to kind of shepherd those projects moving forward. I'm curious if someone in the DHCS team could speak to that.
Sure, I'll take that one as well. So that really is a decision made. The ultimate decision is made by the administration, but really with an eye on, hearing from our stakeholders. We have received a lot of feedback in that space, but also really evaluating what we've been doing as a state at large, especially in particular around opioid use disorders. And so just really taking all of that into consideration, working with departments that have, a responsibility in this space. And you'll see here when Sandy had gone through where some of the funds have been allocated, you'll see that those departments have been working in that space. And really also depending on what work is being done at that time. I know I've seen some questions around some of the workforce efforts, the 51 million that DHCS has around workforce. And just to kind of talk about that, we had started some workforce efforts with some other federal dollars that we had received. And so the administration saw that the results of those efforts were really promising. And so put some of these opioid settlement fund dollars also to expand out on that work. But recognizing that our sister department at HCI really leads a lot of workforce efforts out in California, but they hadn't been, done a lot in this space yet, and we had already been lifting that effort up. So that was an administrative decision to provide us at DHCS with that funding. But what's been really great is then they kind of came alongside of us, and now they have some other funding in this space where they're taking the torch and moving forward with that as well. So it really is, a decision made at the administration level when these funds come down, and really once again looking and seeing what other efforts are being done and already in play, and which departments are really carrying those efforts forward. And that's what will continue as we receive other funding from these future settlements and bankruptcies.
Thanks, Marlies. We have another kind of theme of questions coming in regarding the expenditure periods for the CA abatement account funds and this kind of 5-year and 7-year difference, and really what is kind of the main focus in terms of when funds are earmarked for 5 years versus 7 years, and what does capital outlay mean? I'm curious if the DHCS team can kind of provide some clarification there.
Of course, I can take this one. The state subdivision agreements for the California Abatement Accounts Fund does restrict expenditure periods. And so all of the funds that are received by cities and counties, they have to be expended or encumbered, which means formally committed to an opioid remediation activity within 5 years, or 7 years if it's a capital outlay project. As I mentioned, we have, as part of our policy, a glossary that sort of defines out what's meant by capital outlay. And of course, those would be typically capital facilities projects. And then any of those funds that are not expended within that time frame would be returned to the state.
Thanks, Sandy. There's also a few questions just generally on DHCS's outlook on, what do these funds mean in terms of moving forward? What is the impact that these funds will have, especially in light of current kind of political climate, and just trying to have these more long-lasting kind of sustainable solutions in terms of efforts and services provided at a local level? Curious your thoughts there.
I can start with this one. How I view the opioid settlement funds, because I have a broader lens around all of California's funding around substance use disorders. And so I see, what comes in from federal grants, what is, occurring at the state level, especially in the space of Medi-Cal, and then also just recognizing with some newer funding around Proposition 1, the Behavioral Health Services Act. What I think is very unique about opioid settlement funds is while they are very clear in the utilization of how they must be expended, it also adds some flexibility. So I think they can really be used as gap fillers, perhaps. Especially at the county level, because our county partners receive different, sources of funding, like I just mentioned, from the state level and the federal level. But these funds can be a little bit more nimble, I think. The opioid settlement funds, they can also be used, if there's work that wants to be tested, perhaps around some innovations that maybe another county or city is doing. So there's some flexibility in that, in the sense of, utilizing evidence-based practices and other things like that. So I think what makes these funds so unique is that ability, and also some of them, quite honestly, have a longer time frame than some other funds that our county partners receive, which can be really beneficial as well. I really foresee that for our counties, and some of our city partners have really put a lot of thought in how to utilize these funds, and just some of the questions that they come up to us with, or some of those that bring their plans forward to us, that we see a real thoughtfulness there. And once again, that's why we are so ready and able to assist in that space. So if any of our partners haven't taken advantage of that assistance that we're providing, we really would encourage that, because it's really important to us that these funds are thoughtfully used in order to really make a difference at the local level. And I don't know, Sandy, if there's anything else you wanted to add to that.
No, I really think you captured that. It's important when we look at, well, there's this expenditure period, and then I'm seeing some questions come in about what about the interest? Are there expenditure periods on that? And the expenditure periods for the abatement accounts funds, they're intentional. I mean, I think it's important for us all to be reminded that the opioid crisis is happening now, and it's been happening. And, people are literally dying across the country as a result of this opioid crisis, and it's destroying families, it's destroying communities. And so when we're looking at expenditure periods for funds, there are so many uses that are considered to be effective, and our department is here to assist with that. And I know that there are a lot of resources. I mentioned getting in touch with your local opioid coalitions, who already are aware of what's needed in the community and effective uses of those funds. And I'm sure it's probably tempting to some extent to say, well, maybe we hold on to them for a little bit, or the interest earned. But in reality, as we do that, what we're seeing is just more destruction as a result of this crisis. So we really, at our department, are encouraging effective uses of those funds, but also some urgency in the use of those funds as well. And we're here to help with that.
Andy, along those lines, I know you had touched on the interest. There's definitely a lot of questions regarding just interest-bearing accounts, what funds can be put into interest-bearing accounts, and then interest that is earned on these funds, how is that supposed to be used? Curious if you could kind of provide some clarification there as well.
Yeah, so as mentioned, the abatement account funds, the 70%, DHCS has listed policy that any interest earned would go back directly towards opioid remediation activities. However, did not include an expenditure period for that interest. So what we would hopefully see is cities and counties using those funds quickly, instead of holding on to those funds unless there's consideration for reserves. For the subdivision funds, DHCS didn't establish requirements for expenditure of interest, but again, encourage our cities and counties to use those funds as quickly as you would any of the other funds that you receive from the abatement accounts fund. So hopefully that kind of answers those questions, but we didn't strictly establish an encumbrance period after funds are encumbered, nor did we establish an expenditure period of any interest that was earned on those funds.
I just want to add into Sandy's response that, this is our initial guidance. If we find that becomes an issue, or that those funds aren't, being expended in a timely manner, we can always revisit that. But to just kind of further accent Sandy's point is, this is still a crisis here in California. So we're really encouraging the utilization of the funds quickly, to get to those remediation activities, that includes the interest as well. So, but if we find, this is something that DHCS will watch, as with all pieces of this implementation. And if we need to provide further guidance or kind of box that in a little bit more, we can explore that as this continues to roll out.
Thank you both. There are a few questions as well, just in regards to revenue and when and how long folks can expect kind of this revenue to be coming into California. Curious if you all can speak on that.
I'll start with that. Let me first pull out my crystal ball because we just don't know. You know, we are obviously watching and, you know, keeping apprised and keeping in close communication with the Attorney General's office. And we're always watching, you know, on the national level as well, what's occurring in this space. But it's really just too difficult for us to like predict at this time. You know, what we do know is for the settlements that have finalized and how long those expenditure periods are. And of course, we're tracking those the most closely, but we do have, you know, an eye on the horizon as well. But outside of actually, if somebody does have a crystal ball they can send me, we really just at this point don't know. But we are poised and ready. We have the structure in place in California for, you know, receiving those funds and ensuring it, you know, those funds get to the entities that are responsible for expending them. And then we have, of course, through the structure we presented today, through the reporting, you know, really trying to make it as easy as possible for our partners, because it is a lot of different settlements and bankruptcies that are coming in, but really trying to streamline those processes so folks can really focus on what's most important, which is, of course, expending these funds efficiently and effectively.
Thank you, Marlies. There are also some questions about, right, this flow of funds to cities and counties. How does that work with these various national administrators and maybe reallocations within city and counties themselves? Curious, Sandy, Marlies, or Jenny, if either of you all can speak a little bit more and revisit that kind of transition of funds to local entities.
I'll do my best on this one. So to date, the settlements, somebody correct me if I'm wrong, Janssen distributors, some of the pharmacies to date, those payments are coming in from the directing administrator, which is Brown Greer. And the only off one of that is the bankruptcy from Mallinckrodt. And that's being handled by the National Opioid Abatement Trust. So what cities and counties should be seeing is that payments will be flowing from the directing administrator, Brown Greer, and then NOAT. But reminder that Mallinckrodt bankruptcy ended up filing a second bankruptcy. Is our understanding that final payments have been made by Mallinckrodt. We know that there's an administrative burden in reporting to DHCS on all of these different settlements. And since no more payments are expected, it might just be a good technique to consider expending down your Mallinckrodt funds, because then in future reporting cycles, you won't have to report on the use of those funds any further, as we're not anticipating any further payments from them. The directing administrator also, I don't know if we've popped this into the chat, but Brown Greer also has a web page that lists out all of the projected allocations and payments over the years. And so, Aurora, if we can't get it in the chat right now, our team can provide that when we send out all of our questions and follow-up responses to everyone. But there is a place where cities and counties can look and get an idea of what those projected payments might look like and for how long those payments might come. Just note that there are a lot of factors in determining how much a city or county will get, and that includes participation, you know, how many are going to take those funds and reallocate them to their county or to another participating subdivision, how many will direct out of, how many cities will opt out of direct payment, and then the allocation will go directly to that county. So it's a little bit complicated, and I did just see that that was popped in the chat. But that's a good tool for cities and counties to use to kind of get an idea of the amount of payments and allocations that will be coming to your city or county.
Great, thanks, Sandy. And yes, everyone, we have popped into the chat both the Brown Greer webpage, but then also the DHCS opioid settlement webpage regarding payment information, which you can find some of those links on as well. Let's see. We have a lot of questions from city and county officials and representatives. Thank you all for joining. Very exciting to have you here. A lot of folks are wondering, Sandy, Marlies, how do they get involved with DHCS? How do they find their person at DHCS that's going to help them with that technical assistance and answer those questions? Curious if you all can shine some light there.
Yeah, sure can. Again, on our webpage, we have a technical assistance process. Really, it's just sort of navigating through this form to ask your questions. What funds do you want to use? And as much detail on that as possible for DHCS to provide a response. I will be honest that when those forms are completed and submitted to our team, it almost always results in a meeting where we can have an open dialogue and discussion. Because again, we want to support cities and counties with effective use of those services and of course allowable expenditures. And so there is a team of about 11 of us, and as those reports come in from cities and counties, we implemented a process this reporting period where every time a report is submitted, you're being contacted by your analyst from DHCS to just go over that expenditures report with you, just to make sure that it's clear and that we understand those uses and expenditures before we formally accept that report is completed. You can also just email the OSF inbox. It's osf@dhcs.ca.gov. And find out who it is that is assigned at the DHCS team to your city and county so that you can communicate with them directly as well. So lots of avenues to reach out to DHCS. And again, we're really open to meeting with you to just really kind of look at what are you thinking about, what are the projects that you want to fund, is it allowable, and really determining the best use and most importantly, the efficacy of the use of those funds.
The only other thing I want to add in is I hope that you're picking up on, like, we're very passionate about this work and we really are here to assist our county and city partners. And, we have had folks bring us, proposed expenditures where we're like, nope, that is not allowable. And that would end up being disallowed and you'd have to have repayment and, the consequences for that. So I just want to make sure it's clear, like, it is truly technical assistance and you're welcome to bring us any sort of questions in that space. It's a safe space. Where it doesn't become so safe is if you've already expended the money, because that is when we have to move more into our enforcement role, because we have to adhere to make sure that this is just used for opioid remediation. So if you have any doubts, reach up to us out front. More than happy to tell you, yes, no, or you might want to go this way. And you can use that with us throughout the entire process as you receive more settlement funds. But it really is, once the expenditures have been made, we do have to move into kind of a different role at DHCS to really ensure that effective use. And we take that very seriously at that point. But we're very hopeful that we don't have to get to that stage. But we do have that authority that is outlined and the steps that are need to be taken if that does come to fruition. But we really are just trying to encourage folks up front to make sure your expenditures are proper. And once again, too, not just proper, but really being effective. So there's, technical assistance that we can provide in that space as well with the team.
Yeah, I wanted to add to that too, is not sure we touched on it really in detail in our presentation today, but during the national opioid settlements, the reason that Exhibit E was created is it was contrasted against the tobacco settlement agreements from many, many years ago, and those master settlement agreements where the uses weren't necessarily of those settlement funds restricted specifically to smoking cessation and how do we support people to reduce tobacco use. And what was seen from that through some analysis after watching those expenditures from those tobacco settlements over years is that many of those funds were directed to other general uses outside of really supporting tobacco reduction efforts. And so that was sort of in the forethought when the negotiations were happening in the national settlement agreements, which is why Exhibit E came to fruition, this list of allowable activities. And really, I think it's important to note that these funds need to be used for prevention, harm reduction, treatment, recovery services, that sort of full continuum to support individuals from ever becoming an opioid user and preventing that from happening, as well as harm reduction activities. How do we support opioid related overdoses across the state? And then, of course, supporting individuals with treatment and that sort of ongoing recovery. And so if you're looking at funding activities at the local level, it's really important to sort of guide yourself through that Exhibit E and say, this is kind of what we were thinking for a project, and we're here to support you to just sort of explore how that looks within your city or county.
Thank you both. We have a few questions as well regarding reporting. When cities and counties are submitting their report, how can the average resident of California know what is happening at their local level? How do they access those reports? Are those available anywhere?
Well, yes, as of last week. So this is our first year. Payments started coming in 22, 23, and expenditures started to happen. And those reports, so this state's overall annual report about California and all of the city and county uses, has been published on the DHCS opioid settlements webpage. And there's also links to each of the individual cities reports, city and county reports as well. So if you just go to the city or county that you're looking at, you can open their report directly and be able to see what the uses were.
Thanks, Sandy. I'm seeing a lot of praise and a lot of people agreeing regarding just focusing these funds on the people that really can benefit. Harm reduction. I'm seeing a lot of treatment programs, different ideas kind of flying around. There are some questions regarding how do cities and counties in the state connect with those people who are kind of most in need and might most benefit from these services? How does that kind of play into these different plans that either the state or city and county kind of makes in terms of what will be funded and what's going to be focused on moving forward?
I can start with that. I would encourage folks, if you haven't reviewed already, we have some prior webinars really highlighting some evidence-based work, promising practices. We've done a lot of work in that space just because obviously this is really important to us as well. So I think that's a really great starting point if you haven't seen those yet. I think also just really taking advantage of our technical assistance. So if you're in an area and you want to learn a little bit more, maybe you're a county or city partner that is newer to this, having these opioid settlement funds, and you want to understand more about your general area, we can make those connections for you as well, just because we have a lot of those connections at the state level. So we want to be, a bit of a relationship builder as well, because that is really going to help with that effective use. We've also been doing some partnering up of our cities that maybe they haven't received, a large enough amount of funding to, make an overall impact yet. And so they've wanted to, work with their county partners. And so we've facilitated some of those arrangements as well. So more than happy to do that also in that space, because ultimately our goal is to have that, most effective use. So those are just some initial ideas that I can think about. But once again, you're always welcome to reach out to us if you need help in that space.
Thanks, Marlies. There are a couple questions regarding, again, DHCS's oversight and how DHCS either maintains or monitors the funds that are in interest-bearing accounts, especially generally like at a state level. Does DHCS monitor and kind of house all of the funds for the state level? How does that work?
Yeah, I can start with that, and then Sandy can add a little bit more flavor in there. And so, yes, we are responsible for monitoring the funds at for the state projects and also at the local level, like I mentioned before. We do have some monitoring protocols that we, are instituting. Our big focus off the top has really been the technical assistance, getting the reporting structure in place, helping our partners. We've done a lot of work getting those initial reports in and recognizing that was our first time and, learning that process. And we will continue to do that. But now that we have the reports, we'll be enacting some of our monitoring activities. If there's anything that's questionable, we can always conduct a site visit, do a full, visit in, look at the books, look at the, all of the back documentation, because we have that authority to make that happen as well. And so that is, that piece will be, kicking off more now that we have this reporting structure. Of course, as Sandy mentioned, there haven't been a ton of expenditures yet, which we fully expected when this started rolling out. But as that continues to, expand and ratchet up, that will also increase our monitoring efforts as well. But Sandy, is there anything you want to add?
I was just going to add too, for the state's portion of those funds, as we mentioned, is that the payments go directly to the litigation deposits fund, which is administered by the Department of Justice. There have been some instances where those funds sat in that account for a short period of time. However, and so they may have accrued interest. And then when transferred, those funds were transferred into the opioid settlement fund administered by DHCS. It included the payment amount as well as the interest that was accrued. The legislature and through the budgetary process, I can't remember, it was close to 96% of those funds were appropriated immediately out to state-directed opioid remediation projects. So the state intends to continue to take all the funds that are transferred into the opioid settlement funds and appropriate those out for state-directed opioid remediation activities.
Thank you, Sandy. I'm seeing our questions trickle in a little less quickly lately. It looks like there's a few folks still hoping to get connected with DHCS. Christina, if you wouldn't mind dropping in the DHCS email in the chat, that would be great. Again, folks who are interested in connecting with DHCS on your city and county's expenditures, any of the city and county representatives here today, please feel free to reach out to the OSF inbox, and then DHCS can connect you with your specific specialist to talk a little bit more about those technical assistant opportunities. Let's see. I'm not seeing any other questions coming in the chat aside from those individuals hoping to connect with their DHCS specialist. I'm curious, Sandy and Marlise, again, kind of thinking about the future of these funds, generally the state's approach into opioid response and moving forward. Curious if you can provide any additional kind of insight in terms of what's next, what is going to be the next years in focus in terms of opioid settlement and the great work happening at the state and local level.
I can start with that. I think we're really fortunate in California in this field. We are kind of seen as pioneers, as we are in a lot of other spaces in California around innovation. And so I have the fortunate opportunity to work with other state partners that lead out efforts around substance use disorders, and they're always copying us, which I think is fantastic. And so I'm really excited personally to see, as this funding continues to roll out, what some of our counties and city partners do that's innovative, that's new, that we want to watch for that to see what's working. I mean, we've done so much work in this space at the state level, and so, but always open to what's happening, whether it's for, a diverse population, or special population or a special area. So maybe it's a rural practice that, really is becoming promising. So we're going to be really watching from the state lens, just really seeing around the innovation that could develop from these funds. Like I said, because they have such a wide breadth of ability to be utilized. So we'll be very interested to see what happens in that space. And then also, even if it's not a new and innovative practice, what kind of outcomes are folks seeing? What are we learning in this space? And so how can we encourage other county and city partners, whether it's utilizing this opioid settlement fund dollars or other dollars around substance use disorders, the most effective way that we can. So that's, I think, something that we have an eye on. Of course, we'll always be watching to see, the level of funding that's coming in, and watching that, because obviously that's very important element of this as well. But I do just want to recognize for our county and city partners that have been on this webinar today or are listening that it's been a lot of work. It's been a lot of learning for you all. And so we've really appreciated, working together with you and partnering in this space. We are also watching our other states to see, how they are implementing this work. And there's a lot of opportunities that myself and the team have to learn from other states. But quite frankly, our counties and cities are pretty awesome. And so once again, we're out in the front of this parade, which is fine by me because we've really have done an incredible work in this space, but we've got a long ways to go. Until every individual that has an opioid use disorder has access to medications for addiction treatment, until we have, just enough saturation of naloxone across California, until we have, prevention models in every school or setting that a young person is touching, until we have MAT available, through our harm reduction sites, whether it's syringe exchange programs or whatever it may be, or in emergency departments, jails. Until we have all that work accomplished in California, we need to keep moving forward. And so we will keep that effort going at DHCS and marching forward in that space. Really excited to have the partnerships, especially with our new city partners in this space. I've really loved learning what they're doing because some of them are just newer in it. But we will keep that kind of beacon and leading forward at the parade, and just are really excited, like I said, to see how these funds are expended and the value of them and the outcomes. And then I just want to turn it over to Sandy so she can add her piece as well.
Just wanted to touch on your mention of the learning piece. And I do, want to express that our team is very committed. DHCS is very committed to the use of these opioid settlement funds and to really getting help to those who need it, and to prevent every young adult or young person from acquiring access to opioids. We really want to see good use of these funds. And in that effort and in the spirit of learning, our team has been planning a series of webinars that will be rolling out here shortly over the next year and a half. And those will be filled with learning opportunities. We've also considered communities of practice opportunities as well. And thank you for all of you who took the time to complete a survey that came out from DHCS asking you really, what do you need from us? How can we help you? And if you took the time to provide that information to us, it will be rolled out in a series of webinars and learning opportunities in the coming year. And so we thank you for that. We thank you for the partnership and appreciate all the work that you're doing at your local level.
Thank you both. One last question for us to end today. A lot of folks are saying they just appreciate this opportunity to kind of come together, learn a little bit more about what happened during the first year, and talk about, looking forward into the future. Curious, one, is DHCS going to have similar forums in the future? And then two, how do people stay involved and kind of keep up with these different conversations from DHCS?
Well, the great news is, at a minimum, you get to see us every year because we will be doing an annual meeting just like this every year, just to go over what we have learned from the reports that we have received, and just really doing a similar presentation. Of course, next year we expect that we'll be focusing in a little bit more on the expenditures, expecting that the expenditure levels will be increasing over time. And we've already been hearing that from our partners that that'll be the case. So for sure, you can see us annually. And as Sandy mentioned, we will be continuing to provide technical assistance. We're always kind of monitoring, what kind of questions we're receiving, what is it that folks need. So, if there is something that you want to hear from us on, like, once again, just let us know. Obviously, we love helping and serving our folks out in the field. So if you want to see us, just let us know. But we will, in the meantime, of course, continue providing those technical assistance opportunities. And then if something were to arise that is perhaps really out of the ordinary through this process, we would, of course, come together and convene folks just to relay that information. I don't know what that circumstance would look like, but if that were to be the case, we would make that happen. And then, Sandy, do you have anything you want to add?
The only thing I was going to add, if you want to hear from DHCS on a regular basis, is to email that opioid settlement funds inbox, and we can add you to our distribution list so that you're getting all of the communication from our team around opioid settlement funds. And of course, the upcoming webinars, the publishing of annual reports, and a variety of other forms of communication. So if you haven't done so yet and someone forwarded you this meeting invite, please take the time and email us and ask to be added along with anyone else to our distribution list so that you can be included in all of our communications.
Thank you both. That's all very helpful. That is going to complete our presentation and meeting for today. Thank you all for joining this webinar. Again, today's materials will be available on the DHCS OSF webpage later this week. DHCS is also going to post a Q&A document for any questions left unanswered today, though, again, I think we were able to cover quite a few today, so that's great. If you all have any other questions or, again, want to connect with the DHCS team, please feel free to reach out via osf@dhcs.ca.gov at any time. Thank you all again and have a great afternoon.
Thank you, everyone.
Thank you.